So I'm going to be discussing interleukin diseases and therapeutic uses. So to start out, I want to start talking about some cytokine diseases, and these can actually be either due to genetic effects in the cytokine activity or underexpression or overexpression of cytokines or cytokine receptors. So let's just start out by discussing a few of these cytokine-related diseases. And the first one I want to start out talking about is called septic shock, which is actually very common and can be quite deadly. Bacterial infection is actually the major cause of septic shock, despite all the antibiotics we have out there. And septic shock actually falls under a much broader category of something called sepsis. So what is sepsis? Well, sepsis can also be caused by bacterial infection, trauma, injury, ischemia, and cancers. And sepsis, surprisingly, is actually the most common cause of death in ICUs throughout America, and it's actually the 13th leading cause of death alone in the U.S., so it's pretty scary. And a common feature of the sepsis is an overwhelming production of pro-inflammatory and fever-inducing cytokines such as the TNF-alpha and the IL-1 beta. And this cytokine imbalance that it produces can lead to fever, alterations in your respiratory rate, a high white blood cell count followed by capillary leakage, tissue injury, widespread blood clotting, and even lethal organ failure. So sepsis can be very, very serious and have serious repercussions. Bacterial septic shock often develops because bacterial cell wall endotoxins will actually bind to your innate immune system, pathogen receptors such as toll-like receptors, or that are on your dendritic cells and macrophages, causing them to produce IL-1 and TNF-alpha levels that actually can lead to pathological capillary permeability and even a loss of blood pressure. And sepsis actually remains an area of intense investigation, and they're trying to clarify more about the process involved in bacterial septic shock because they still don't know that much about it, and it's a major killer, and they're trying to learn about it and hopefully prevent it in the near future. And another cytokine-related disease I want to talk about is bacterial toxic shock. Bacterial toxic shock is actually caused by a superantigen of induction of T-cell cytokine secretion. So superantigens have a very unique binding ability, and because of this very unique binding ability, they can actually activate extremely large numbers of T cells. And the large number of T cells activated by these superantigens actually results in excessive production of cytokines. Just for example, the TSS-T1 has been shown to induce extremely high levels of TNF-alpha and IL-1 beta. As in bacterial septic shock, these elevated concentrations of cytokines can induce systemic reactions such as fever, blood clotting, and shock. So now let's move on and talk about cytokines in cancer. Of course, abnormalities in the production of cytokines or the receptors have actually been associated with some types of cancer. Specifically, some are lymphoid and myeloid cancers. It's been found that abnormally high levels of the IL-6 were secreted in a benign heart tumor, myeloma and plasmacytoma cells, as well as cervical and bladder cancer cells. So on many occasions, it's been found that cancer and an increased level of production of cytokines have been linked. Continuing on, recent information has actually come out that type 2 diabetes and cytokines are actually linked as well. It is thought that problems with the cytokines TNF-alpha and IL-6 and the role that they have in cytokine signaling actually play a profound role in type 2 diabetes, and which is actually becoming a huge problem in developing countries and will be predicted to affect at least 40% of Americans in the next decade. So a major crisis kind of coming up, and yet again found to be linked to cytokine disease. And I just want to finish up the diseases by talking about something called the cytokine storms. So occasionally a very, very violent infection may induce the secretion of extremely high levels of cytokines. And these cytokines are then going to go into something called positive feedback. So the increase or the production of cytokines will lead to and cause more increased production of other cytokines. So They're just going to continually, out of control, start producing all these cytokines. And normally positive feedback loops are kept under control by self-regulating immune mechanisms, but some viruses just cause a localized, exaggerated response that result in an extraordinary, unusual high level of cytokine. And this inability to stop the positive feedback effect and uncontrollable production of cytokines is called a cytokine storm. And these storms typically come with symptoms such as increased capillary permeability, with a loss of blood pressure, and shock can actually lead to death. And what's really unclear about which viruses can cause these storms and which can't, but they are thought to have been linked to the 1918 Spanish influenza pandemic and possibly the SARS epidemic that occurred in 1993. And actually effective treatments for these storms are still being developed. So now let's talk about some therapeutic uses. So the availability of purified clone cytokines, monoclonal antibodies directed against cytokines, and soluble cytokine receptors are actually prospects of specific clinical therapies that they're trying to use to control and monitor these immune responses. Interferons and colony-stimulating factors such as GCSF and IL-2 have all been used clinically. Even reagents that block the pro-inflammatory effects of TNF-alpha have been proven to be useful in fighting certain cytokine diseases. And so I found some cytokine therapies that I were unaware of. I'm going to show you. I just thought it was crazy how prevalent they are. So specifically in the book, it kind of talks about Enbrel up here, which is actually a soluble TNF-alpha receptor, and Remicade and Humira right here, which are monoclonal antibodies against TNF-alpha. And these are both drugs that are actually used to reduce pro-inflammatory cytokine cascades. They help to alleviate pain, stiffness, and joint swelling, and even help promote healing and tissue repair. So that's pretty incredible. And these drugs have actually been found useful in treating rheumatoid arthritis, which I didn't know. And you'll see on this list, it's pretty incredible that all these diseases such as rheumatoid arthritis, Crohn's disease, hepatitis B, melanoma, MS have all been linked, they think, to cytokines, and they have all these drugs that they can use in therapy to help with this. So that's pretty cool. Last thing I want to talk about is, although all these new therapies are coming out, you have to be aware of the risk and the possible repercussions with using these, because drugs like these actually interfere with the normal course of our immune system and by reducing that cytokine activity, and that's going to bring an increased risk of infection and malignancy. And just one example is that it was actually found in patients, or high frequency of patients with lymphoma actually were using they were long-term users of the first generation of TNF-alpha blocking drugs. So they were kind of linked those cytokine therapeutic drugs with the cancer, and so that's not good. And just kind of to wrap it all up, further technical problems are actually being encountered in trying to adapt cytokines for safe routine medical use, because they just propose many problems, such as cytokines are hard to systemically administer, they have a very short half-life, and the fact that these cytokines are extremely potent biological response modifiers that can produce undesirable effects, and they're just very unpredictable. However, though, the use of cytokines and anti-cytokine therapies in clinical medicine will hold great promise, and there are actually many efforts being made to develop safe and effective strategies. But it's actually particularly in those areas of medicine that have so far been kind of resistant to the more conventional approaches, such as cancer, organ transplantation, stuff like that. So yeah, that's cytokine diseases and therapies, and feel free to use my video.